Hello, my name is Sandra Rose, and it's great to be here with you today. I am an NHS Autism and Learning Disabilities Key Worker. My role is to align with and advocate for children, young people, and their families to help avoid unnecessary admissions to mental health hospitals. I also have a background in paediatric nursing and more than 20 years' experience in leadership and management. My motivation to join the programme was to be instrumental in promoting positive change in the way my team and our services support autistic people and their families. I have been particularly inspired by the National Autism Trainer Programme and the specialist refreshers, as these give everyone an opportunity to come together, develop further my thinking, my action plans, and my role in my service as an agent of positive change. Today, I want to share my experiences and 3 key messages. So, number 1, the curriculum introduces a collaborative and values-oriented approach. This approach actually validated my own thinking and my efforts, and it gave me the material that I need to enable me to share my ideas and vision with other people in my team. It is not easy to make whole service changes, and it is not hard to feel alone in this effort, disappointed even. My evolution, my understanding, it doesn't always match others' experiences and attitudes. And sometimes I even doubt how to process much needed changes. And I do feel alone at times on this. However, this program validated my experiences in so many ways. I witnessed the kind, safe, and warm atmosphere during the online sessions. It is not that there weren't any debates. There definitely were debates, and there were intense discussions because delegates care a lot, and also because delegates have many different backgrounds, ideas, and biases. But these were handled most of the times with genuine curiosity, openness, and accountability. I opened the mic multiple times to share, to reflect, and I listened carefully and deeply to others. This kind of experience, along with clear slides, videos, great animations, they inspired me to go back to my team and to the services that I'm in to steer important discussions and actually run taster sessions to get my colleagues to start thinking about the need to also deliver the National Autism Trainer Programme and to engage with its core concepts. It's not easy yet, it hasn't been easy yet to organise a full delivery, but I have been creative and I'm not giving up. The second key message I wish to share is that an experience-sensitive approach is helping us to make better use of evidence-based methods by personalising and contextualising our plans. One of the key learnings I took away and shared with my team is how to understand and support behaviours, I was going to say of concern, but I've now reframed that, behaviours of distress. And this is a message I push. To protect anonymity, I won't refer to specific events here, but what I can tell you is that we were able to, as a team, reflect on how we understand, how we talk, and how we write about autistic patients' behaviours in a way that is not stigmatizing and does not lead to restrictive practices. Many support schemes for autistic people are designed to support them to fit in and conform to idealized notions of neuronormativity. Their lives are often invaded by interventions to be less autistic. So rather than caring for autistic people in a way that accepts and develops their individuality, emphasis on behavior plans often tacitly take neurotypical behavior as the standard to aim at, which leads the autistic person to mask their autistic traits and repress their atypical sensory and emotional reactions, or to protest and react to this. My training here meant that I was able to advocate for a client in a time of crisis in inpatient care in a neuro-affirming way when reporting on risk incidents, and I saw a small ripple of change there. I supported first the clinical team to take seriously the wishes and needs of the young person under their care. This involved challenging the network to take the child's views and wishes to return home as the starting point of care, to reimagine together what transition from hospital to home would look like and what support would be needed for this transition and post-transition. Through this program, I felt confident and supported, and to challenge the team to consider environmental triggers, including the parent's own pathology narrative. Having access to slides and references from the program, but also having time during refresher specialist days to rehearse my thinking and to think collectively with others, thereby strengthening my ability to interrupt some automated processes that may not work well for autistic patients. In my case, the biggest win is that a clinical team started paying more attention to the context that was creating an emotional burden for an autistic young person. Recording the incidents was not enough because they were creating a negative impression and it was creating fear. It wasn't saying anything about the environment and what the relational triggers were. Recognizing these, we were then more able to empathize and remove those triggers. The third key message I want to share is that my hopes is about my hopes, really. My hopes are that we can coordinate and further our efforts, roll out the training to all staff, and create working groups to support all of us to audit our practice and improve outcomes. I hope that the National Autism Trainer Programme will remain inclusive and responsive. I had the chance to be inspired and to inspire others, and to feel part of a growing community that cares and that tries. We are not left alone, and that empowers us to commit to be the change we want to see in the mental health sector. Thank you for listening.